Overall, it's been an overwhelming positive experience that I've had here in Delhi for the last 4 days. We've visited many different research and education institutions. Today, I had the pleasure of meeting with the Indian Minister of Health and Family Welfare. And we've also had the opportunity to discuss more in detail on how a possible partnership between my country, Denmark, and India on recruitment and education on welfare, on healthcare workers could be. So it's been a very positive, very fruitful visit to Delhi, and I'm stunned by the sense of optimism that I feel is dominating in this country.
How do you think this plan of recruiting Indian health workers to Denmark would strengthen the Danish nursing and healthcare sector?
Well, it would, in the sense that Denmark, like many other European countries, are challenged when it comes to recruiting personnel to our welfare system, more particularly the healthcare system. So we have a recruitment issue in Europe when it comes to that. Then I can also see that actually the quality of education of nurses, etc., here in India is very, very high. So I think that there could be a genuine mutual benefit from a possible agreement between our two countries when it comes to us then offering career opportunities of working in Denmark.
Ma'am, when your foreign minister was here for RISE, and I think he had a discussion with our foreign minister of this mobility pact, how do you think that discussion will give a momentum and pace to this plan that you have?
Well, you can say that the Mobility Act sort of opens the doors to more specific recruitment. This is then a part of that, exploring the possibilities of recruiting and also educating healthcare personnel from Denmark to India. So you could say the Mobility Act sort of lays the ground for a future more specific and concrete collaboration in recruitment.
Are you in talks with other countries as well? And why India? I mean, if you can, by and large talk about the Indian healthcare sector, we are known as the pharmacy of the world. We have supported countries with vaccines when, we were going through the pandemic. So why India?
Well, India is the first country that we have this discussion with and where we are negotiating with or having discussions with to complete such a partnership. So India is a very well-educated society, specifically when it comes to healthcare. So that is the number one reason. The other reason is it is also English-speaking country, which of course levels the language barrier that might be between two countries, especially for the individual who had to move to another country and also make a life for itself. I mean, taking on a job in a different country is not only about the working conditions and the profession that you carry out, it's also about the life that you create for yourself there. The ability to actually make friends and being included in social networks, etc., which of course on a individual personal level is very important. So I think the ratio of success for actually having a good life being a nurse, for example, in Denmark is good when you also have your mother tongue being English.